Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Dopamine agonists versus levodopa. So, which is better to give? Is it better to start the patient with levodopa or with dopamine agonists? So, so we will see what are the important uh, advantages of starting the patient with dopamine agonists. So, first, if you start with dopamine agonists, these dopamine receptor agonists will have the duration of action. First, the duration of action of these dopamine receptor agonists is longer than that of levodopa. Levodopa has problem of wearing off and on off phenomenon, but in this dopamine agonists have no trouble of wearing off effect. There is no wearing off effect is not seen, and even on or off phenomenon is also not seen in patients with dopamine agonists. And dopamine agonists, according to one hypothesis, it is said that the dopamine metabolism is occurring, and this dopamine metabolism is responsible for formation of the free radicals, and these free radicals are actually responsible for, or these dopamine metabolism will is responsible for formation of free radicals, which will mainly contribute to the neuronal death which occurs in Parkinson's disease. So in such cases, obviously, uh, using dopamine agonists will have better action when compared to usage of other drugs. So as a result, these dopamine agonists are considered as first line agent for Parkinson's disease is actually a dopamine agonist.
thank you and thank you for watching.